Sylvia. So in your answer, you touched a lot about the importance of being able to protect patients' information. In response to Dr. Chong's question, the hospital would have to adapt to having computers in every room, meaning that the electrical grid would have to be redone, the rooms would have to be changed in a way that would allow for computers to be in there without interfering with the space for the patient or the quality of care that the patient would receive. Ideally, what we've seen is there are usually a lot of computers in a nurse's station. Ideally, we would do away with those to give the patients more time, more quality. A lot of times patients will walk into a doctor or a hospital and, they do get frustrated with the layout of the facility because they can't tell directions, because honestly, sometimes when you're coming out of a doctor's office, it does look the same when you come out. There's no give or take. The layout is important in hospitals, in doctors, and in my favorite answer, retail. Retail is just something I'm very familiar with. I've been doing it for almost 10 years. When you go to a store and you look at your checkout line, for example, you have candy, you have gum, you have those things that you normally wouldn't get. They're not normally on your grocery list. But when you get to the line and you're waiting and the cashier is talking to the customer for like 20 minutes, they do reach out, and they're called impulse lines. When you're going through a doctor's office, it is nice to see the credentials and the achievements that the doctors have done. It gives patients a little confidence that the doctors actually do know what they're doing. It also gives the patient the ability to see that the facility is maintained, it's cleaned. I've left a doctor's office, or I have not entered into a doctor's office because I think that it's disgusting. If you don't have a clean layout, if it's not friendly, if it's not, hospital or, wheelchair accessible, you're going to turn away a lot of patients. So, hopefully the hospital that you work at or the facility that you work at, they are smart enough to realize some of these things.